Hello everyone, I'm Dr. Tefia Debbie. I'm a consultant psychiatrist and a psychologist. I make videos on mental health education and self-improvement tips. My goal is to help demystify mental illness and provide you with self-help tips that will help you be your best and live your best. This video is the third in the three-part series on attention deficit hyperactive disorder. ADHD is said to affect 2 to 7% globally of the world's population, and it is usually diagnosed in childhood, and over 50% of those diagnosed in childhood go on to still have signs and symptoms in adulthood. On today's video, I will be talking and focusing on treatment strategies for attention deficit hyperactive disorder. Just in case you missed the first two videos where I talked about the signs and the symptoms and the common myths and facts about attention deficit hyperactive disorder, also called ADHD for short, you can check on the YouTube channel and go back and see the previous videos on ADHD. People with ADHD are, when not properly managed, are more likely to have significant impairment in the outcome of their life. Children with ADHD are more likely to be very disruptive, and because they are disruptive, they are more likely to get called out or more likely to get punished. Children with ADHD and adolescents with ADHD are more likely to have oppositional defiant problems, and they are more likely to have conduct issues. As adults, they are more likely to have antisocial problems. People with ADHD will struggle with relationships, and they are more likely to get divorced. People with ADHD may struggle at work and are more likely to get fired. But on the flip side, they are also more likely to be entrepreneurs. People with ADHD may struggle more with substance. They struggle often with their self-esteem, and they struggle often with depression. You have more of them dropping out of university, that's not completing their university degree, because of the challenges that they often have to struggle with. There are broadly two categories of treatment for ADHD. The first is behavioral therapy, and the second is medication. Now, the recommended treatment for an individual depends on the age of diagnosis and the extent to which the signs and the symptoms affect their daily living. For children less than 6 years, the recommended treatment is usually behavioral therapy, where you have parent training program. Now, the goal is to educate the parents about the nature of the illness and equip them with strategies that will help manage the behavior. The goal is not to outsource all of this to the therapist, but rather to train the parents on how best to manage the child. Now, medications are not usually used for children less than 6 simply because of possible side effects, and research is not much in that area on the possible effects long-term that it can have on the child. That is not to say it can never be used, but it is not the mainstay of treatment for children less than 6 years. Now, for children 6 years and above, there is usually a combination of behavior therapy and medications. There are two major types of medications used for the treatment of ADHD. Number one, they are called stimulants, and number two, they are called non-stimulant medication. Stimulants work faster. Usually within the space of an hour, the effect is noticeable. About 70 to 80% of people on stimulants give good response that they experience. For non-stimulants, they do not act as fast as the stimulants. Usually it takes days or sometimes weeks before you can see their effects. About 50 to 60% of people on non-stimulants will have good response. Non-stimulants are usually used where stimulants do not work or has not worked effectively. Sometimes they are used in place of stimulants, and sometimes they are used in combination with stimulants. There are quite a number of stimulants used for ADHD available out there, but they are all controlled drugs and should be used under strict prescription and should not just be given out lightly. Before you go ahead to take on any of the medications, whether stimulants or non-stimulants, it is strongly advised that you meet with your provider, your mental health provider, your psychiatrist, to prescribe the proper medication that will best suit you. I hope this video has been helpful. If it has, please share it. And just in case you have not already subscribed, kindly subscribe to this YouTube channel. That way you get reminders every time we put up our videos on mental health education and self-improvement tips. Thank you so much.